Well, hello, Facebook, and welcome to the Joe's Body Shop Facebook Live segment for today, October 31st. Happy Halloween to everybody. And we're going to demonstrate what we just talked about 15 minutes ago with the Colorado Springs School of Massage. Let me show you how we work with trigger points. Come on back here. I've got a couple of pictures to show you, and I think you're going to really enjoy this segment. I have got my research books here. I'm not selling anything. These are the ones that I learned with. The Myofascial Pain and Dysfunction, the Trigger Point Manual. So let me show you a little bit. I've got some pages marked here for you so that we can take a look at a trigger point. Now, we talked about trigger points. They're an odd little knot in a muscle that refers pain to a distant part of the body. And so for a lot of you that get headaches, guess what? Headaches come from back here primarily. They can come from here. If you get a knot in one of your clenching muscles, it can radiate upward towards the head. We've got lots of muscles in the neck, in the shoulders, and in the upper back that will also transfer pain into the head that we recognize as headaches, but the source is from a muscle problem that you've got somewhere else. Let me show you how really chronic things can get. Let's talk about in the glute complex. We have got 9 major muscles. The lower half of the glute complex is where the piriformis muscle is. You see where those X's are? That is where you would have the knot, the trigger point. But all these little red speckles, those are all different places where pain could be felt in association with that trigger point. And so you can see the entire butt cheek all the way down the back of the leg from one little knot. And it can change. It might be down the leg today. Tomorrow, it might be up into the upper part of the hip. Here's another one here. If we're looking at legs, here on the front of the thigh, in the quads, you can get a knot right there. And look at all the different areas where pain has been identified, where it radiates. Over here on this other page, more indications of where the trigger point is and where the pain referral pattern goes to. So you could have pain on the side of your leg, and it's coming from behind the knee. Or you could have pain all the way up and down the side of the leg, and look, it can be from a knot in your side muscles. That's vastus lateralis, and in the vicinity of the IT band. So trigger points can be a crazy phenomenon and really a pain in the butt to try to identify. Here's a different book. This is actually the first volume of that, and you see I've got lots of little markings in there. But here's another one where up here in the shoulder, a lot of people get problems with this muscle, and it's up in the shoulder, but look at all the different places where the radiated pain can wind up being. And so how do we injure this muscle? We can injure that muscle by sleeping on it wrong, by improper lifting, or if you are a perpetual shrugger where you find your shoulders up around your ears all the time, this muscle is being overworked. Same way with the arm. Look at the arm. You can have a knot up here in the forearm, and yet you could feel the pain really strongly into your fingers. And that's kind of what I want to show you today. What do we do with these trigger points? And so, as we started talking about during the school video, I have got a problem right up in this area here. And although this is not where I really feel it, I can touch up here and feel discomfort. It's like, that's really sore, but wow, I really feel it down into these 2 fingers. And so the finger muscles actually originate up here. As you do this kind of activity, you can see movement up here. It might be difficult for you to see, but do it yourselves. Do like you're typing and check your forearm. There's lots of muscular activity up there. And depending on which one of the muscles has the trigger point in it will depend on where you're going to feel it down in the hand. And so let's start by warming up the area. And we're going to warm it up, getting a little bit deeper, and you'll start feeling through the skin layer, through that first layer of adipose, that little fatty layer, until you start hitting the muscle layers and you'll start feeling the muscles. And pretty soon, you'll hit that spot that's tender, and it feels like a little marble under the skin. And so this is where we could start doing circular cross fiber to start breaking down the knots, the fibrous part of that knot. We want to go ahead and break it down. We can really get in there and do a really, really strong ischemic compression. Now you'll notice we're not moving. And the best way to do this is to have your client tell you, how bad does that feel on a scale of 1 to 10? 10, of course, is really, really bad, and 1 is barely nothing. And they'll probably tell you that's like a 7. And you just keep that pressure constant. Don't move. You're choking out the blood supply to that muscle. And after 10 seconds or so, they'll say, ooh, it's not a 7 anymore. It's a 5. Just have them count it down. Ooh, it's a 4 now. Ooh, it's getting better and better. And pretty soon, when it gets down to about a 2, okay, you can let off the pressure, go in and rub it out, and then start checking the remainder of the length of that muscle and see if there's any more trigger points. Because sometimes there's one that's hiding another one. These little trigger points are tricky suckers, so you got to be careful with them. And so that's how we worked that one out. You can also go through and create a stretch. Curl the fingers and pull down, and that's going to stretch all these muscles out. If you just sit there and pull the knot out of the muscle, that's pretty cool to do, and it's a lot less intense than sitting there squeezing and choking out the muscle. So we're going to go there, stretch it and rub it out, stretch it some more, rub it out, until finally the sensation is cleared up and you can move on to the rest of your massage. How many of you have had trigger points? Have you experienced any, Debbie?
Oh, yes.
Oh, yes. Where do you get yours?
Mostly in my upper traps and my neck.
Upper traps and neck. And what does that feel like? It's tender here.
It's hard to describe. It just feels like I've got a big golf ball in my muscle.
Right? And many times that will create, if it's up in here and it stays there for any length of time, you could start, and I think you have had headaches from that, haven't you? I've heard headaches. I have heard weakness in the arm or in the leg because that particular trigger point is tightening up the muscle so much that it's affecting blood flow, circulation. Nerves can get entrapped in those knotted up muscles.
I've had that.
So we need to be careful about that. When you hear somebody talking about, I don't know why, but I'm losing strength in my hand, that's an indicator that they ought to go get seen. If they have a good massage therapist, have your massage therapist look at it. If you don't have a massage therapist that does that therapeutic style of work, we're here. We've got 3 therapists working here. They're all exceptionally good. So if you need to get in, we can get you in pretty quick. We can get you in within 2 or 3 days. But don't let that persist. Go get it taken care of.
Numbness.
Numbness, yep. Numbness, lack of strength, difficulty sleeping. That's another good one. You have so much discomfort that you can't sleep well. Have a hard time getting to sleep, and then once you do get to sleep, you're tossing and turning because you're not comfortable. So here's the number, 719-444-0708. Call us. We're more than happy to talk to you about your condition. We're certainly happy to go ahead and get you in here so that we can get our hands on you. You had another question?
No, actually, I had a comment.
Sure.
So if you're over the age of 40 and you find your bed is beating you up at night, come see us.
It's your bed's fault, but we can fix that. We'll give you a massage and make it all better. So, hey, you guys have a wonderful Halloween. Don't eat too much candy. And if you do, come in and get a massage. See you later. Bye-bye.
Happy Halloween.
Happy Halloween.